joined by Dr. Emma Runswick, who is the Deputy Chair of the British Medical Association, as we are asking if junior doctors are right to strike. So 0207 862 2222 is the number to give us a ring with your views on this one. Now, junior doctors in England have announced that they will stage a 4-day walkout in April as they continue to call for a 35% pay rise. Now, the government says that it's unaffordable, but the BMA argues that an increase will make up for its 15 years of below inflation rises. Now, Emma, last time you weren't on, but the last time we were speaking about the junior doctor strikes during the last strike, we held up this, which is the pay scale of the junior doctors, and there was a bit of confusion about it and what each level stood for. Do you want to take us through it? So FY1, what does FY1 mean?
So an FY1 is the first year of post-qualification. So all of these doctors are fully qualified doctors. They are just in different places in their training to become either a general practitioner, a consultant, or a specialist. So an FY1, that first year of qualification is earning £14.09 an hour, because we're paid by the hour. And they are the person who overnight is the first person to come and look after you. They will assess you. You might see them in A&E. They will be doing all of the jobs on a ward that are associated with making sure that your scans are done, ordering your medication, making sure your discharge is smooth, and so on. At FY2, that's the second year post-qualification, if you've passed your FY1 level.
Foundation Year 2.
Foundation Year 2, absolutely. So that's at £16.30 an hour. So that's gained an additional year of experience. You are then beginning to be trusted to do things like assisting in surgeries, running clinics. You will have some time in general practice, potentially, again, seeing your own patients, though at extended appointment times.
And what does CT and ST stand for?
Core trainee and specialism training. So you move through a kind of generalist approach first. So that might be in general medicine, or it might be in general surgery or psychiatry or pediatrics, and you kind of get more and more specialist as you go up the grades, including, so at CT1, CT2 level, that nodal point 3 is £19.30 an hour. By the time you're at ST3, ST5, you're at £24.46 an hour, and ST6 to ST8 is £28 an hour. So at the time you're at the end of that process, you have at least 10 years of experience. Many people take multiple years out, both for their own personal reasons, like parental leave, but also to do things like research, to gain experience in other areas. People might spend
so between 10 and 15 years?
Yeah, absolutely.
So to get through all of these levels, 10 to 15 years.
Yeah.
And where do GP salaries fit into this?
So GP training ends after GP ST3 or 4 if you have done additional layers of work. So people who are academic trainees who are doing research alongside their training will end at ST4 sometimes, and then majority of them will be go on to be salaried GPs earning approximately £60,000 a year. Some of them will become partners running their own businesses, and their earnings are very variable.
Now, this shows foundation doctors and junior doctors.
So all of these doctors are junior doctors. From the first year of qualification to 10-15 years of experience.
And once you get to this point, you become
a consultant or a specialist.
Got you. Okay, thank you. We cleared that up. Marina, what do you think? Junior doctors out on strike. They want 35% pay rise.
Fully support them. 35% sounds like a lot, but they've had a 26% pay cut since 2009. So this is a pay restoration. This isn't even a pay rise. Look, I think we need to decide as a country, right? Bear in mind, we're on the brink of a real problem here because we've got GP exodus, for example. I think 40% of GPs are planned to retire or leave the workforce in the next 5 years. So we need to have a plan here. You know, they speak about attracting the best people into like the banking industry. That's why they remove the cap on the banker's bonus. Well, what about attracting people into this industry? We need to pay them a decent rate. And look, do we value our doctors? Do we value our healthcare? Do we need them or not? Because if we do, we need to take into account the fact that these people have to pay for their own training, exams, fees, regulation. They then work. They have to pay for their parking. They have to pay for shift-based childcare. They've got about £100,000 worth of student debt. So can we start paying these people what they deserve? They are the people that literally restart our hearts, remove our blood clots. Can we pay them a decent wage?
They are sort of emergency frontline workers, though. Is this the right way for them to go about it, Lynn?
I think they absolutely deserve a pay rise. And sometimes drastic measures is needed to be able to be heard. I understand that. However, I don't know how that they will fill the gap of people that really need to see doctors, considering the waiting times that we're seeing in the NHS at the moment. And I've actually got a question. why is there heavy emphasis placed on the government and not the actual NHS? We know that the NHS receives billions from the government, and a lot of the money is wasted every single year, billions. We can see that in PPE, aside of COVID. We can see that in consultants receiving well over 100,000 a year. Why is the conversation not looking at auditing the NHS and looking at where those funds are going and getting that money to you instead of criticising the government?
Because the government makes those choices. So the government has chosen over many years, not just this government, but prior governments since 2008, to impose restrictions on the supposedly independent pay review body. They have imposed pay freezes or below inflation pay rises, which in real terms means we're worse off. It's not really for us as doctors, I'm a working doctor,
Of course, yeah.
to say, where should this money come from? They can make those decisions if they want to, but the decision that they've made is causing a massive workforce crisis. I've just this weekend been to another leaving party. I've got 2 friends who are in paediatrics training, who are specialty trainees in paediatrics, leaving for New Zealand in September. And when wages and working conditions are so much better abroad,
Yeah.
spending the money to restore our pay from £14 to £19 an hour is absolutely well worth it. It's for the government to decide how to pay for that.
Let's take some calls now. Sorry, Marina. Dennis from Essex, what's your views on these strikes? Do you think that they should go ahead? This is the only way to get the rise that they're looking for?
No, I don't think. I think what's on the table now is a good offer, and they should take it. And the reason I say that, I spent
What's on the table,
a
Dennis?
month out of the last 6 months in hospital, and I came out 2 weeks ago. The first time I went in with a stroke, and the second time I went in with a kidney stone. They couldn't find the kidney stone the first time, and I was ill for about 5 months. The junior doctor came in to see me. I've been in hospital about a week. The junior doctor came in to see me, and I had a CT scan, and she came in and said, "No, I'm 74 years old. I've been in the building industry all my life, and I've never been ill before." She came in to see me, and she said, "You've got cancer." My son is sitting there, and she said, "You've got cancer all over your body. It's spread everywhere." And I said, "Have I got time to go home to sort my affairs out?" And she said, "Well, yes, you've got time." Anyway, the next day I had an MRI scan. She come back in the next day and said, "Oh, I'm sorry about that. I made a mistake. You haven't got all you've got your lesions and bits on your liver and stuff on your spine and that, and it's not cancerous."
Okay, I can hear where this is going. It's just a general complaint about junior doctors, but Dennis, I'm just going to pause you there because you brought up a really interesting point. You said they should take what's on the table. Emma, what's on the table?
There isn't anything on the table. I'm sorry, Dennis, you had a really bad experience, but the government have literally offered junior doctors nothing. We're not included in the wider NHS offer. We received 2% last year, which is in real terms a 10% pay cut, the equivalent of working this year a month for free compared to last year. So in that context, we got loads of our colleagues leaving, which means that for those of us who are still here, the work is harder. We're making more mistakes. We're not providing the care that people like you deserve. We know that. And it's one of the many reasons that people are off to Australia, New Zealand, Canada. We want to fix that workforce crisis, reverse the pay cuts that we've had so that everybody gets the care that they deserve in this country.
Dennis, thank you very much for your call and all the best with your health problems. The government, though, have said that they're willing to negotiate wages for this year and future years, but you have to call off the strikes, and you're not calling off the strikes. Their argument would be you're halting the negotiations.
So before we announced this round of strike action, we opened our doors for the government. We agreed 4 of the 5 available meeting dates. They continued to mess us around, dilly-dally about. When they finally came for a scheduled half-an-hour meeting, they put no counter-offer on the table whatsoever, just further preconditions saying that we couldn't talk to our members about what was happening in negotiations. They then left and briefed the media against us, and the following day we announced further strike action because we have got absolutely nowhere. We've got no trust in the government that without further strike action, we can move this dispute onwards. There's no offer on the table. We'd like there to be one.
Yeah.
Well, let's speak to David now from Shropshire. What do you think about the junior doctor strikes?
Oh, yes, hello. Well, all medical staff are worth every penny they get and a whole lot more. And I think the junior doctors should get a lot more as well. I mean, look, the National Health Service is the most important thing that people have in this country, and it's always been free at the point of need. And if ever we was to lose our health service, the only people that would be able to afford health care would be the very rich, while everybody else would fall by the wayside. And quite frankly, that scares the hell out of me.
David, what about Lynn's argument, though, that the NHS in itself is sort of mismanaged, is hemorrhaging money that actually could be pointed in the direction of nurses, junior doctors and other staff?
Well, I suppose it's true in a way, yes, but I mean, there's all sides to this, isn't there, that you have to look at, and I just feel so passionate about the health service that it just needs to be protected and improved.
But another counter-argument to that would be that the NHS was set up to protect us, to look after us, and yet we've spent a lot of time at the moment trying to protect it.
They waste over $7 billion a year.
Does that not show that it's not working, David?
Yeah, well, it needs to work for everybody, doesn't it? You know, for us, for everybody. I just don't know. I'm sorry.
No, not at all.
Jump in and say, look, an organisation as ginormous as the NHS, there is always going to be some wastage, and that's a real shame.
$7 billion a year?
$7 billion a year, and I think a lot of that waste actually goes into funding, paying for agency staff, because we don't recruit enough people actually into the service, so we have to pay extortionate amounts for agency staff. Another thing I just think we need to really point out here, government doesn't care for doctors, right? And the reason I'm saying this is because they have imposed a limit of the amount of GPs that can be trained. Do you know they are fining universities up to £100,000 per additional person that they add on to the GP courses, because at the moment they're saying there's a cap because the government has to fund some of that. Can you imagine that?
The government has to fund over $160,000 per doctor, but I support it. I support that but we can't say that the taxpayer doesn't pay for any of the studies that doctors do. But I 100% agree that they deserve a pay rise. And you're right, we will hemorrhage doctors and they will go, and what will we do?
There's no long-term vision whatsoever.
Emma, thank you very much for joining us. Thanks for all your calls on this as well. We are going to have to move on now.